Good afternoon, everybody. Thank you so much for joining us today. Today we're going to be learning how to implement a telehealth program in a small hospital or clinic. Troy DeLello is kind enough to be presenting for us today, so thank you so much, Troy. Before I hand everything over to Troy to let him get started, I want to go over a few housekeeping things with you. First, all of you guys are coming in with your lines muted. At the end, we'll allow you to unmute your phones and ask questions or make comments or have a conversation with Troy. Throughout the webinar, if you have any questions, please enter them into the chat feature down below. I will be interrupting Troy throughout to get your questions answered in real time, which is amazing. Another point of note is the fact that this webinar is being recorded. You guys will all get a copy of the webinar as well as the recording by the end of the day today. So without further ado, I'm going to go ahead and introduce Troy. Troy DeLello is an AWS and Google certified. He has served in senior management for nearly 2 decades, with the majority of that being in healthcare IT. Over those years, Troy has been the head of information technology and operations for startups as well as established companies. Troy was recognized by Toggle Magazine in fall of 2019, so just last year, and published a short article about his work at Forefront Telecare, where he was the Chief Technology Officer. Troy is currently the managing partner at DeLello IT Services. So thank you so much, Troy, for doing this presentation for us today.
My pleasure. Are we ready to get started then?
Yes, sir.
Okay, I am gonna just turn my video off. Video. All right, excellent. So thank you for joining this webinar today. We're gonna be talking about implementing a telehealth program with a focus on small hospital or clinic, but the information that we go over today all really apply to just about anybody who's interested in telehealth. Okay, let me just get this slide to work. There we go. I am Troy DeLello. I've already been introduced, so I'll skip that. I had sort of a notable career with Forefront Telecare. We brought that company from the ground, having absolutely no business, to about 5,000 billable claims per month. Their focus is on skilled nursing and small hospital psych units. I'm currently working with I'm currently a partner in DeLello IT Services doing IT consulting. I'm also senior consultant for Envelop Telehealth, which is a telepsych startup, and I'm doing sort of a virtual CIO for a couple other projects. Above there, you can find my LinkedIn and my contact info. Okay, so let's get into this. Today's objective is to learn how to pick a secure and compliant telehealth platform. Our focus is on small operations like rural hospitals and clinics. But again, the information can be applied to just about any business. We're going to keep it simple today. We're going to look at 3 cloud solutions that can help you accomplish your goals for your telehealth program. There's many others. So even though I picked these examples, you might be looking at something else. These are definitely not your only options, but hopefully it'll help you kind of frame up in your mind, you know, what it is that exactly you want to implement. And that's really the objective today. Okay, so this is security over compliance, right? So we want to start out with a little agreement between us. I've got some bullet points here, but before we talk about that, what we're looking at in this neat little triangle, this is called the CIA triangle, okay? These are really the 3 pillars of security and, you know, as it applies to platform delivery in my mind. Confidentiality, integrity, availability. Those are the 3 pillars. And we're going to rely on the platform for availability, but confidentiality and integrity are something we can work on. So how can we bolster that part of the triangle? Well, first of all, and I know this is obvious, and I'm sorry if this is really obvious, but treat your telehealth program the same as your in-office program. So your existing security and compliance policies, your standard of care, your privacy policy, those are things that are not going to be different in your telehealth platform. So don't think of your platform as something you're kind of bolting on and it's different. It's really an extension of what you're already doing. And I think that sort of frames you for success when you look at it that way. And I think it's really important. And just a side note, you know, when I've done this in the past, I always wanted to minimize the technology that's in the way and really focus on care. And I don't do care, so the way I can help with that is to just make the platform and the video and everything that's integrated into the telehealth platform as seamless as possible, almost like it's not there. And that's really when I'm looking into how to get started in these programs, that's what I have in my mind. Regarding security, there's a couple things, and these are sort of generic, but they are very applicable to your telehealth program. Use a different password for every system. So when you sign up to things, use a unique password. Don't use, you know, like November 2020 or whatever, star asterisk. It's not good enough. Those are great dictionary attacks. You know, they're in the systems of hackers. They know these. They just have to put a couple different ones together and they crack your password. And if they get into one system, they got into them all, unless you have different passwords for each and every system. So yes, I know it's a hassle. And, you know, I have probably 400 passwords, but I have a system to deal with that. And so let's talk about that. The other thing, well, we sort of mentioned this, you know, I like passwords like this. 8*40$ Dov Cappy or whatever in the world that says, because who's going to guess that, right? And I know you're thinking, yeah, me too. I'm not going to remember that. So that's where a password manager comes in and is extremely helpful. So I use LastPass. There's a number of these on the market. LastPass has a free version. They have a paid for version. And there are several really top-notch utilities that you can use to manage all your passwords. And so I recommend that highly. I don't know anymore how people operate without it. To be honest with you, it's just too hard. And you end up writing your passwords everywhere, or you have a spreadsheet. Well, guess what? If somebody hacks your computer and you have a spreadsheet of passwords on there, that's not good, right? So, and ultimately, get your IT department involved to help you in this process. You need to have password management as part of your HIPAA program, and most certainly your IT department or IT contractor or whoever it is that you rely on for your other IT matters should get involved in this, and they should get involved early, like now, because they can help you, you know, navigate this world. And so again, I just really encourage people to do that. Multi-factor authentication, you know, this is not so new anymore. I think everybody's familiar. You know, you put in your username and password and you get a code on your cell phone, in your text, or through some other means. That's your token to continue. And this really, really helps secure everything. So I say, turn on multi-factor authentication everywhere, not just your telehealth program. Put it on your email, put it on your EMR, turn it on everywhere you can. Get your IT department to help you roll it out. It's extremely important. And, you know, multi-factor is something you are, so that's like your username, something you know, that's your password, and then something you have, and that's the token that you get. So it actually adds a whole nother leg to your authentication method. And so please use it. Other factors when we're looking at sort of choosing a platform are end-to-end encryption and video calls. You must have this, it is required. So your platform has to include it. And then encryption at rest for data. So if you're going to be storing documents in some storage system, those need to be encrypted at rest, meaning even when you don't have the file open or you're not accessing it in their stored state, your system needs to have encryption. And your IT department can help you with that if you don't already know. Depends on where you're storing your documents. In the platforms that we're talking about today, if they do store documents, they do have encryption end-to-end for video calls and at rest. And then another thing, I know we all get annoyed by constant reminders from our applications that say, you know, there's a new update available, and maybe we're busy, so we click it down. But don't do that. Go ahead and install them right away. When you have the latest applications and updates, you have the latest security as well. All your vendors must be HIPAA compliant. There's not really an exception to this. If they're a covered entity or a business associate, you have to have a HIPAA, they have to be HIPAA compliant. You must vet them, and you must have a BAA for every vendor. And so, you know, get your IT department to help you aggregate that, to help you navigate the world of the different encryptions and all that, to make sure that you're comfortable with it and that sort of thing. In regards to vetting your vendors, you know, this is always kind of a topic that not that many people do it, and they are supposed to. And my take on this, and although I'm not a compliance professional by trade, so you may want to ask Sarah some of these questions too, but in regards to vetting your vendors, this is the way I look at it. If it's a small vendor and I can show up to their office and have a meeting with them and actually see their systems and talk to them, I'm going to do that if it's feasible. And if it's not, and maybe it's too far to travel, I'll have that, you know, I'll have a video or a phone call with them and go over how they, you know, are securing my patient's data. And if they're a big company like Zoom or one of these guys, you know, you can go on their website and you can pull up their policies. They're usually published, and you know, you can vet them that way. So that's how you can kind of vet any vendor, and you should always do it and document it. And ultimately, you're responsible for your patient's privacy. So it's a serious business, and you know, you and your IT people and associates can do a good job at that. Okay, so now that we agreed that that's a good idea, we can start picking our telehealth platform. And so I like to start with, you know, what is your mode of delivery? Are your patients going to be at home and your providers in the facility? Are your patients at the facility and your providers going to be in a remote location? Or, you know, more of a business to business kind of thing. Maybe your provider's in the facility and he or she needs to speak to a remote provider. Or you could also have the case where you're bringing in a provider who's got a specialty. And so that's a mode of delivery. But when it comes to supporting people in their homes specifically, you have to decide, you know, what devices you want to support, because people will be connecting with all kinds of different devices. It might be an iPhone or an Android, could be a PC or a Mac, could be a tablet. So it's good up front to decide, you know, am I going to support all these devices, or am I going to have a limited range where I'm only supporting maybe phones and mobile because it's a little bit easier? You know, and does my platform do that for me? It's important, obviously, that your platform can support what you intend it to. And then how are you going to communicate with those patients at home? Are you going to call them, text them, or email them? Because there's some important security, you know, and HIPAA ramifications. Phone's generally okay, as long as you're following your typical, you know, compliance procedures for talking only to the patient or their POA or caregiver. But if you're going to SMS or text your patients, you're really starting to go down a slippery slope. And you know, there's a whole bunch of different opinions on this, but my opinion is texting with just carrier to carrier, like if I'm T-Mobile and you're Verizon, or it doesn't matter who has which, it's not HIPAA compliant. And the minute you start bringing PHI into that conversation, you're definitely in hot water. You shouldn't be doing that. There are secure texting applications, but it's not SMS. It's not, you know, sending it to their number. They have to download and install a client. So make sure that you have that hammered out before you ever start this process. You know, how are you going to communicate with your patients? If it's over email, I was waiting a second because I saw my internet connection got unstable. Okay, hopefully everyone can hear me. If it's over email, those communications all need to be encrypted, and you'll need encrypted email to do that. You're probably already doing this stuff, but I just wanted to mention it. And then do you have all the documentation in order that you need? Because if not, and you need to get documentation from your patient who's at home, you have to figure out how you're going to do that. So you might want, you know, patient intake forms and forms delivery built into your platform, or you might want to handle it some other way, like DocuSign. You know, these are things like, excuse me, face sheets, insurance information, telehealth consent, which, by the way, you do need for every patient, and that sort of thing. If you don't have that up front, then you're going to have to decide how to get that, and then you might want that in your platform. And another, and this is not a focus of the presentation, but I did want to mention, if you've been billing for patients in clinic and you've never billed for telehealth before, it's become easier recently, but there are codes that are not billable via telehealth. So make sure that you check your patient's insurance and make sure they have a telehealth benefit. It may or may not be illegal if they don't, but don't be surprised that they deny it anyway. So maybe right now in today's age with COVID and all that, I think payers are probably loosening up on that, but I would check, because you do probably want to get paid for your time and your effort. So knowing all that, we can kind of start to look at what features we might want in our telehealth program. So one of them might be patient intake forms. We might want that in the platform. Appointment scheduling. So here's the deal. I know we're all thinking about Zoom, right? Because it's really easy and it's got really good quality, but Zoom doesn't have any real appointment scheduling feature in it. Yes, you can send a link. There's this thing where you schedule inside your client. It's kind of confusing, and then it snaps into maybe your Outlook or your Google Calendar. But essentially what you're really doing is you're setting up a time and creating a link and sending it. And that works okay for low volume. But if you're going to be seeing quite a few patients in their homes and you're trying to manage that schedule, their provider's schedule, that gets really difficult. So if you're seeing patients at home, you probably need appointment scheduling. So that is probably something you're going to want in your platform. Clinical notes. I'm assuming you probably all have EMRs, but I wanted to bring this up. If you don't, you might need notes as a feature in your platform. E-prescribe and e-labs are really nice because you can prescribe right from the platform if you have it. If you already have a means to prescribe and you can reach your patient's pharmacy in their remote location, then great. If not, you might want that built in. Insurance billing. If you're currently, I'm assuming again, you're already doing insurance billing or you have an RCM system, but if you don't, it's really handy to have that built into your system. It'll be integrated with your appointment scheduling and everything else. And so your provider will see a patient, they'll do a super bill, they code, and then once they've coded, it goes into the billing module for your billers to go pull a report and bill out the insurance. If you're starting from scratch, you might want that in your telehealth platform. Or if you're just doing telehealth in the future, you might want that in your telehealth platform all in one system. So that's a consideration. Excuse me. And the thing that gets some people is you're used to seeing patients in clinic and you're used to asking them for their credit card for copays and deductibles and patient responsibility. That gets less good when they're at home and you have a terminal, which is, fine for grabbing a credit card and putting it through. If you're going to be seeing patients at home and you intend to collect copays and deductibles, you might want merchant services built into your platform so that can kind of be done seamlessly. And per appointment, it can be charged after the appointment. Whatever they owe, you can set that up in the various platforms. So that's something to consider. Side note, you don't want to be calling people and writing their credit card down on paper and then charging them. And then you have a mess of PI that, potentially could be exposed, and it's a bad thing. So it's really nice to have those built into the platform. When it comes to your providers working in remote locations, I know everyone feels like, okay, I know how to do this, and Zoom has definitely brought that culture. We have people working from home and everything else. But when it comes to providing professional services, especially medical, it's really important to have a conversation with your providers about that remote location. And you kind of have to vet that just like you would a vendor. So some of the things that, that come up are, how's your provider going to present themselves? What I mean is, this is all related. What device are they going to use? What's in the background? What's the best camera angle? And there's no nice way to say this. I can't tell you how many doctors I've seen, start a video call on a mobile device and then put it down on their desk. So you're looking right up their nose when they're having the call. And I know you shouldn't have to mention it, but it happens all the time. So you really want that front-facing camera. You want to make sure that there's no window nearby where somebody can see in that room. You want good lighting. I prefer a PC or at least a tablet or something a little bigger than a mobile phone for the provider side. For the patient, it kind of doesn't matter. But for the provider, you want to come across as professional and stable and have a good picture and all that. So that's what I recommend for that. Make sure they have a private, secure room. It's probably a good idea that the room locks so nobody can accidentally come in, which is, an infraction. And they need a private and secure internet connection. And you really should probably document that has been checked off, maybe with some details. Your IT people should do that. We want to make sure that they have a firewall in place. And, you cannot share an internet connection and provide services. It's definitely not okay. So that's your checklist, and you can have your IT department help you with that. And I would bring them in for that part for sure. A couple other things that your IT people can help you with. If you're bringing video into the patient, if you're doing bedside in clinic and you have a remote provider, however you're doing that, you really need to make sure you have a good internet connection and a strong Wi-Fi signal in each room. And so I know that's kind of obvious, but you know, I've seen so many times where that's just not the case, where it wasn't tested, and suddenly it's important to see this particular patient, and they take the system into the room, and there's all kinds of connectivity issues. That's never going to be good for your telehealth program. And again, make sure that your provider is in a HIPAA compliant environment that's secure and following all the rules. Okay, so we talked about some of the features. This is just an overview, but these are some of the things that you may be looking into to be part of your platform. So e-prescribe and e-labs, you know, if you need that to prescribe to your patients' pharmacies. And then messaging, you know, text and email and all that. Always make sure that that means of communication is encrypted. And I would really start with even a hi, how are you? That should be encrypted, because what happens is you're baiting the patient into saying, you know, I'm good, but my medication named this and that has run out. And now you've already really gone down a slippery slope. It's not encrypted, even though the patient's the one who said it. We don't want to bait them into that. So let's always encrypt everything. Appointment scheduling and video. Again, Zoom is great, but it doesn't have the scheduling function. So we're going to look at a couple other options as well. Cash and billing. So if you need to bill insurance through the platform, you're going to want that integrated, as well as merchant services if you want to collect credit cards. Clinical notes if you don't already have an EMR, or if you want to keep your notes, your telehealth notes in with the appointments in the platform. You may want that integrated. And then forms and storage, or what I think I called earlier, intake forms. You very well likely want that integrated. So these are three really simple solutions. Again, there's more. I'm happy to talk to people offline if you have a use case that this just doesn't fit and you have some questions. But the easiest three that come to mind are Zoom for Healthcare, VC, and Cario. And these are all HIPAA compliant applications, and they all support you know, all the popular devices, so phones and tablets and computers. In particular, Zoom for Healthcare, by the way, it's not Zoom free or Zoom for Business. You really need to sign up for the one called Zoom for Healthcare. They've recently dropped the price from $500 to $200 a month, and you get 10 hosts with that. So you can have 10 providers using this with whoever they, you know, as many patients as they need to, or other providers. And that's your cost. It's Zoom for Healthcare, not for your business. Those are not HIPAA compliant because they won't sign a BAA. Zoom's privacy and security policy can be found online. There's the link. It's kind of long. Sorry about that. But that's how you can really vet the vendor in these cases where you have a big company who's probably not going to meet you in person. So you could go and read about it on their website and document that you've done that. They're HIPAA compliant. They support complex passwords and multi-factor authentication. They already have an end-to-end encrypted video, and they will provide a BAA for the healthcare product. They have, it's not really messaging, it's kind of chat, you know, during a video call, like we can message each other in this one. But you know, the way Zoom works, you send out a link, and the other side of the call, and the patient in this case, doesn't really have to sign up to Zoom or anything. So once the call's over and they don't have that link to go back to, they don't have any way to message you. So they don't really have a real messaging solution built in. They don't have an EMR, and they don't have a scheduling interface. They don't have billing or a merchant gateway or patient intake forms. So again, I think the best use case for Zoom is provider to provider, or bringing in a specialist, or anything that's really low volume where you don't mind going around and, you know, um, filling in with other services for those things that are missing that you need. The next option in my mind is VC. And VC is a really nice application. It's well supported by the folks that run it. They actually include a BAA for all their plans. So even their free plan or their basic plan, they'll provide a BAA. So they're really you know, security minded. They do have an enterprise product. So if you wanted to go really crazy with this and white label it or do anything outside the box, they can do that by quote, and they're very flexible and willing to work with you. So I really like this company. If you choose it, I'm sure you will too. There is their security policy, vc.com/security, where you can find out all about their security and HIPAA compliance. They are HIPAA compliant. They support complex passwords, and they're working on MFA right now. So they'll have multi-factor authentication around Q1 2021, which I think is absolutely wonderful. They already provide end-to-end encrypted video. They'll provide a BAA. They do have messaging as long as your patient downloads and installs the app. And they even have a light EMR. It's basically the ability to create SOAP notes. If that's good enough for you, that's probably a good solution for you. They do support e-prescribe. They have a really easy to use scheduling interface, merchant gateway, and patient intake forms all built in. You just have to configure it, and they help you do that. The next platform that comes to mind, and the last one that we're going to talk about today, is Cario. Cario includes BAAs for all their plans, but their pricing is not listed on their website, so I can't really talk about it. They do it by quote only. I can introduce you to somebody there if anyone is interested. Their security policy is at cario.com/security-notice, so you can vet them. They're HIPAA compliant. They support complex passwords, and multi-factor is on the roadmap. I'm disappointed that they haven't given me a date for that. They know they need to do it, and I've harped on them quite a bit about it. So they're probably tired of hearing this, but they need to do it, and they are working on it, but they don't have an end date. So VC's ahead of them on that one. End-to-end encrypted video, they provide a BAA. Messaging is included as long as you download their app. And they have really a full, robust EHR integrated with their system. It includes e-prescribe, e-labs, and a scheduling interface, merchant gateway. You know, and it's all in kind of one place. It uses the patient's chart. You look up a patient, and within that chart, you can see their notes, you can see their labs, you can see their upcoming appointments and that sort of thing. So it's really a nice full-featured program. And they also have, and this is something other systems don't, they have a billing interface built in. So really, if you're starting from scratch or you're replacing something, Cario is a really excellent solution to take you from appointment scheduling, video calls, charts, and notes and prescribing, merchant gateway, all the way through to billing. So your provider would go see the patient, and then they do a super bill. They'd code that super bill, and then it would be put in the Cario's billing report, and your billers could grab it from there and bill out the services that you rendered. So it's really a very complete package. They also have built-in meaningful use, MACRA, if that's a concern, with CMS. And they have a patient portal which is kind of well, it's one of the things you can select in MACRA to make sure that your reimbursement stays high with Medicare. So they've kind of thought of everything. They also have patient intake forms built in. So it's a really complete package. Okay, so this is the way I break it down. To choose your platform, Zoom for Healthcare is really good if you already have an EMR, billing, prescribing, and you don't mind sending links instead of actually scheduling things in an interface. VC is really helpful if you already have an EMR, but you need that scheduling and e-prescribe and merchant services. And then Cario is the most complete solution, and it includes the billing. So you got EMR, billing, e-prescribe, and telehealth, and all the forms and everything as well. Some other helpful vendors that I wanted to mention are Nextiva. Nextiva is a cloud VoIP system. So if you wanted a telephone number that was just for your telehealth service, you can contract with Nextiva. I think it's about $40 a month for a line. It includes a telephone number. You can get a toll-free number, and then it has menu-driven system. If you want to do, you know, press 1 for this, press 2 for that. They support voicemail. It is HIPAA compliant. They have an app for the phone if you don't want a physical phone. And then they support IP phones that'll just run on your internet connection. So you don't even need a phone line. If you need that sort of thing, Nextiva is really good. We all probably know what DocuSign is, but if you need signatures from patients that are remote, you might need DocuSign if it's not part of your telehealth platform. So you might want to consider that. It's really, you know, much easier for people to just go to their computer and open an email and sign something that way these days. And then eFax, which everyone probably knows what that is, but just so you know, they are HIPAA compliant and they will sign a BAA. And eFax, you know, I hate fax. So if I have to fax something, I want to do it, you know, via the computer. And that's a great way to do it. And it's nice and secure. Okay, I hope I didn't put you all to sleep, but we're on our last slide. So in summary, secure it all. Ask your IT department to help. They can help you with onboarding and offboarding. You know, providers especially, it's really important to disable their access if they leave. They can help you use complex and unique passwords for all your systems and implement password managers like LastPass. Excuse me. They can help you with multi-factor authentication. And specifically in Zoom, you want to use meeting waiting rooms in admitting locks and meeting passwords. And these other applications have forms of that too. They're just sort of more integrated. In Zoom, you can turn everything on and off. And so if you are going to use Zoom, make sure that you use waiting rooms and that you admit each person instead of just letting everyone in. Lock the meeting when everyone is in, and always put a Zoom meeting password on your Zooms. Another thing I see all the time, and it's just security no-no, is using the same Zoom meeting ID over and over and over again. Don't do that. You know, all you have to do is click one different button that says generate a randomized room or something like that. You'll see it in there when you go to schedule a call. So, you know, create a unique ID for every meeting. That'll keep you more secure. Oh, and by the way, don't put your Zoom meeting in your email. I see people do that too. Or if you do, that's fine, but use that meeting room for business because you're telling everyone in the world how to connect into your room. So don't do patient care in that same room that you advertise out for people to connect to. Keep all your applications updated at all times, and always use encrypted means of communication. So, you know, text and email should always be encrypted. And my last, you know, and I'm sorry, I know you heard this a lot, but it's really true. Your IT department plays a critical role in the success of your program. Include them early in the planning stages and get their support. Okay. I didn't hear any questions. Do we have anything, Sarah?
So we have one right now, which I'll get to in just a second. So thank you so much, Troy. This was all very, very useful. So if you guys have any questions, you can message them directly to me, or you can message them to everyone so we can get those read out for everybody. So the first question that we have, Troy, is would you recommend us utilizing one of these generic telehealth platforms versus one meant for our specialty? We are a neurology office looking to continue telehealth. Currently, we're using free Zoom and are looking to continue telehealth after COVID. So what do you think, Troy?
That's a great question. And I would say it's up to you. If you're comfortable with Zoom, please get the Zoom for Healthcare right away. I know that everyone's operating under the idea that, or under the waiver that says, nobody's going to come after me for non-compliance. But a couple of things to keep in mind are there's also state and local laws that we have to abide.
Absolutely.
And there's also the fact that that waiver is going to go away one day, and everyone who doesn't already have everything compliant is going to be in a world of hurt. So start today and upgrade that to the business version. Regarding your specialty, I don't know. I understand what neurology is, of course, but I don't know what your needs are in that. If all you're doing is checking, post surgery or post appointment, and you're using telehealth to check in with your patients, then Zoom might be good enough, or Cario or VC. If all you really need is to kind of look in their eyes and make sure they're clear and their motor functions are what is as expected, if that's the kind of thing you're doing, then it probably doesn't matter. You probably don't need anything real special. If you're connecting devices, that are part of recovery, or special devices that need to be integrated, then you will be needing to look into a more specialized telehealth platform for that.
That's all really good information, Troy. So one of the things that I would probably say there too is a lot of times when you're seeing these specialty telehealth programs, they're providing the actual provider care for you. So if you're a doctor's office or a hospital looking to expand your own services and provide care utilizing your providers, you just need to double check with those specialty telehealth programs to ensure that you can utilize them to provide your care. Do you agree with that, Troy?
Yeah, I do. And don't forget also, it sounds like you're already doing this, but just speaking in general, don't forget to check your codes to make sure they're billable through telehealth, and that the insurance that the patient has actually provides for that.
Right. For those of you on the call that are critical access hospitals and rural health clinics, check with your rural health consultant. They'll be able to help guide you through all of that, because there's even more specific things that rural health folks need to do. So we have another question. Are there assurances from the providers of these platforms that if something happens like a breach, that you're indemnified from an issue as long as you've used the platform as prescribed?
That's kind of more of a legal question that I don't feel 100% comfortable answering. I would say, again, that's part of your vetting process that you need to do, and go to whatever platform it is that you're interested in, and check it out and see what they state. Read your contract, and talk to those vendors and ask them that question. I couldn't possibly
Right.
assure anybody that that's the case.
Right. I think one of the things that's really important to remember with something like this is that these are contracts and you need to make sure that you're reading them. And so if anybody remembers back when we were all adopting EMRs at like an unprecedented rate, which is exactly what we're doing right now with telehealth,
Yeah,
just think back to those days, right? You didn't just view one EMR and sign up and start utilizing it. You viewed and did demos on multiple different EMRs. You had your attorneys reading through all of the contracts and understanding the verbiage, as well as understanding what your responsibilities with that EMR were. And so the same thing is happening with telehealth now. And COVID forced us to adopt super quick, just like meaningful use forced us to adopt EMR super quick. The difference is with COVID is we were losing revenue because patients weren't able to come in, and now we're trying to adopt telehealth so quickly that we're not going through those same vetting processes that we did when we were adopting our EMRs. And from a compliance perspective for myself and for a security perspective for Troy, like these have to be some of the things that we're trying to like go back and review. So if you already have a telehealth like platform in place that you've been utilizing during COVID, you now need to follow the steps that Troy went through the webinar to ensure that you have all the compliance aspects addressed as well as all of the security aspects addressed. Treat it just like you did when you were adopting the EMR.
that's right. And in some of these cases, it might even include an EMR, and it's that serious, you know. And you really are, you know, and I don't want to get too IT-ish here, but you're really increasing your attack surface when you're reaching out into people's homes. So you really do need to know what you're getting into, what you're signing as a contract. Whoops. And okay, so I use Docker, and everything else, you know, HIPAA requirements, and you know, you really have to know all that stuff. It's very important to vet all of this out and understand what you're getting into. Take a breath. If you don't have time to do it, have somebody do it who you trust. You know, what can I say? You can't get out of this, guys. This is this is your patient's privacy and security, and
Right.
and your reputation. So even if there's a waiver right now that says you can get by with murder or whatever, it's going to go away. And by the way, if you get breached during the waiver period, that's great that nobody's going to come after you for penalties, maybe, but you still have your reputation to uphold. You don't want to show that you did things that were non-compliant, even if it was kind of okay at the time. So,
Well, and they're not going after you for the breach. They'll still investigate you and more than likely find other issues that you have. So you don't want to open yourself up either
right, right.
for that breach to happen.
That's right. And it only states that there won't be, that they'll repeal financial penalties or something like that, right?
Right.
So it doesn't get you out of the other stuff. And again, the way I look at HIPAA is it's kind of like helps me double check myself to help my own reputation so that I'm not involved in something that was not secure, done, you know, hastily. Because ultimately those breaches hurt you. It's not just the financial penalties and the law coming down on you, it's your patients losing trust in you.
Absolutely. Absolutely. So so are there any other questions first? No, awesome. So if you guys think of any other questions, please feel free to email them to me. When I send out the telehealth, or when I send out the webinar recording and slideshow, I will also make sure that I include Troy's contact information. If you guys are in the process of vetting telehealth providers and need access to a telehealth attorney, let me know. We work with telehealth attorneys or healthcare attorneys across the country. I'd be happy to make an introduction to have them help you read through that verbiage, like what Michael asked about the indemnification clauses. Just make sure that you're actually vetting through everything. So Troy, do you have any last words?
No, just also, I guess I did. I guess I do. Uh, I'm sorry to repeat it, but you know, get your IT folks involved in the technical aspects. You can read it, but you may not fully understand some of the documentation or what encryption there, you know, that is being mentioned. So get your IT folks involved. Get them excited about it. You know, when people are excited about being part of something, it really changes their attitude. And I know IT people are generally kind of gloom and they don't really want to take anything new on. But if you get them excited in the early part of the program before you make a bunch of decisions, they're more likely to help you all the way through it. So get them involved and just do the right thing. Forget the waiver and all that. Get everything HIPAA compliant right from the start, so you don't have anything to go back and do. COVID is, it changed the world, and we're not going to go back 100% to the way we were. So you're going to need your telehealth program to last a long time. Just let's get it done right in the first place.
Absolutely. Thank you so much, Troy. Really, really helpful presentation. Thank you, thank you, thank you. And thank you to all of you that spent this last hour with us. You'll have a lovely day.
Thanks so much, everybody.
All right, bye-bye.
Bye-bye.